My name is Kerry Grady Vincent, and I'm the Senior Manager of Scientific and Clinical Programs at Osteoporosis Canada. I will be your moderator for today's webinar entitled Biosimilar for Patients on Denosumab. Before we begin, Osteoporosis Canada acknowledges the land that our offices, located in Toronto, are on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. At Osteoporosis Canada, we educate Canadians about bone and muscle health, including healthcare professionals and their clients. We are the only national organization serving people who have or are at risk for osteoporosis. OC provides medically accurate information to patients, healthcare providers, and the public. Our services include programs and support groups, educational webinars, podcasts, digital tools, and community resources available at osteoporosis.ca. We are excited about today's presentation, which will provide information about biosimilars for patients using Denosumab. It is not intended as individualized health advice. If you do have questions about osteoporosis, please consult your healthcare provider. If you have questions during the webinar, remember to click the question and answer button on your screen to submit your questions, and we'll try to get to as many as we can, time permitting. Before we begin, make sure you have your speakers turned up fully so that you can hear the presentation clearly. It is now my pleasure to introduce our speaker, Dr. Teri Charrois. Teri is currently the Associate Dean of Practice Innovation and is a professor of teaching at UBC Faculty of Pharmaceutical Sciences. Dr. Charrois graduated with her Bachelor of Science in Pharmacy from the University of Alberta, and then went on to complete an accredited pharmacy residency program, followed by working as an internal medicine pharmacist before finishing her master's degree in clinical epidemiology. In 2014, she joined the U of A Faculty of Pharmacy and Pharmaceutical Sciences as academic lead of practice innovation. During that time, she completed her Doctor of Education with a focus on adult learning and decision-making. Teri was the first pharmacist in the Northern Alberta Osteoporosis Program and provides clinical care in the multidisciplinary bone health clinic with the Division of Rheumatology at the University of Alberta. So please, without further ado, welcome Teri.
Hello, everybody. I'm just going to start sharing my screen. I'm hoping you can all see that now. So welcome. I would like to acknowledge that I'm calling in today from the campus at University of British Columbia on Musqueam territory, and it's a beautiful, surprisingly sunny day here today in Vancouver. I'm excited to talk to you today about biologics and biosimilars and what you need to know about Denosumab and how this new drug on the market may change how we manage care. So we're going to talk about what biologics and biosimilars are. So having some understanding of those two terms will help in your understanding of what the change is. And then we're going to talk about how this might affect your osteoporosis management. What I cannot do today is give you any personal advice on your own osteoporosis treatment or predict how anybody, yourself or your family members, will respond to any therapy. So I'm just going to give you sort of a brief overview of these medications to arm you with maybe some questions you can ask your physician who's prescribing your therapy. So I'm going to be using some terms today that require a little bit of defining. So the first thing I'm going to talk about is a reference drug. So this is the original medication that we're building off of. So in this case, the reference drug for Denosumab is called Prolia. So you take Prolia, it's Denosumab, it's the original drug that was on the market and licensed for osteoporosis therapy in Canada. The biosimilar drug is the newer medication that's been based on that reference drug. So it is marketed as Jubbonti in Canada, and it is based on Prolia. So what are biologics and biosimilars, and how are they different from other drugs and generics and those terms we normally use? So biological medications, or biologics as we call them, have very complicated structures, and they have a lot more components than most regular medications we use. So they're composed of multiple elements that come from living cells. So we grow these things. So they're grown in a lab, often with things from yeast or bacteria or other things we find in living cells, proteins being one of those. And they're grown in a lab environment for whatever treatment is of interest. Most medications are just simple chemicals. So traditional medications are a simple chemical structure, and we know what the structure is, and we can easily copy that structure. So they're considered small molecules, and they're very simple. I'm going to show you a picture because I think it helps kind of bring this home. So this is an example picture of what the structure, the chemical structure, the biologic structure actually of denosumab looks like. So you can see it's lots of things going on, multiple elements. There are some chemical entities, there's some biologic entities. So that's what denosumab looks like under a microscope. As compared to something like alendronate, which is a commonly used osteoporosis medication. It's a simple chemical structure, and you can easily copy the structure. So drug companies or generic companies can copy this structure and make something exactly the same as alendronate. So biosimilars, so that's the newer drugs, so like Jubbonti, they're very close in structure to the original reference medication. And they behave in the body the same way that that reference drug or the original biologic behaves. But they're not considered an exact copy. So that's why they're not called a generic. And that's because these living materials that are grown in the lab to create the biosimilars may have very, very, very small differences from that original drug. So obviously the big thing patients ask is, how can I trust that this new biosimilar is going to act the same way as my original medication? And Health Canada has a very rigid structure of how they actually approve these drugs. And this is based on approvals in other countries as well. So we know that the newer drugs, those biosimilars, are all tested and compared to that original drug. So they make sure they go through a wide variety of tests and that they act similarly to that original drug. And that their efficacy, so how effective they are in preventing fractures and help stabilize or increase your bone mineral density, that's all the same. And that the safety is similar, so that there's no increase in adverse effects with that new biosimilar. So how it's termed by Health Canada is that there's no meaningful difference between the two. So between the original biologic and the new biosimilar. And we use biologics and biosimilars in lots of different medical conditions. Osteoporosis is just one of the newer conditions where biosimilars are coming through, but they are used in a lot of different conditions. So in terms of what Health Canada requires, so what the drug company that's making the biosimilar, they have to go through a rigorous protocol where they have to show that the drug behaves the same way in the body as the original drug. So how we absorb the drug, how we metabolize the drug by our cells in our body, and how our body gets rid of the drug, that is the same way as the original drug. The clinical effect has to be shown to be the same so that it works in the same way and to the same extent as the original drug, and that it has the same rate of side effects as the original drug. And so we know that the new biosimilar, Jubbonti, has been studied in a large number of patients for a relatively significant amount of time, and in both men and women. This is some information from Health Canada, and this applies to any biosimilar, not just Prolia and Jubbonti. and what they are and how we can be sure that they're going to react the same way in our bodies. So a biosimilar is a biologic drug that's highly similar to another drug. And they have to be approved by Health Canada through a thorough comparison with the reference drug, and that there's no clinically meaningful differences in how they work, how good they work, and how safe they are. So again, we see these biosimilars and biologic used for lots of different medication or lots of different conditions, sorry. So diabetes, some cancer drugs are biologics. So we have used these drugs for a number of years, biosimilars for a number of years. And as it says here, and as I stated before, is that they're made from living organisms. So it's really hard to copy one to another because all living organisms can be slightly different. And that Health Canada expects no differences in how you respond to the biosimilar as you would have responded to that original reference drug. So why do we even have biosimilars? So it's similar to why we have generic drugs. So when the original reference drug comes on the market, they're given a patent for a period of time to protect that company, that company's investment and all the research and development and how that drug was studied and came to market. And then after a period of time, that patent expires, and then other companies can make these biosimilars to go onto the market as well. And clearly they're a much they're a less expensive form than the original, because a lot of that research and development has already been done. And this is why companies do it. So very similar reasons why there's generic drugs on the market. In terms of how the new biosimilar Jubbonti has come to the market, it's received all its Health Canada approval in phase 1 and phase 3 studies. It's approved for across use in Canada now, but there are currently province to province differences in what's covered and how it's covered, and that's a moving target. So some provinces are still reviewing the information and determining what they will cover and how they will cover it. So one of the common questions, obviously from patients, this is clearly the main question we get asked, is do I have to switch treatment? And it really depends on what province you're in. And you need to discuss this with the physician who's prescribing you your osteoporosis medications. I work in BC, so I know in BC right now, they have a program in place where all patients who are currently on the original drug, the reference drug Prolia, must switch to the new biosimilar Jubbonti by March, and then they will end coverage. So the government in BC will end coverage for the original drug Prolia after March, and they give a window of time to get people changed to the new medication. And that's a government-based decision. In terms of is it easy to switch from one to another? It's exactly like just changing your next dose. So you follow your normal treatment plan, and when you're due for your next dose, so if you got your dose January 1st of 2024 and you got your next dose, July 1st of 2024, you would just use the new drug instead of the old drug. So you don't change the timing of the medication or anything like that. The dose is exactly the same. It is given the same way in a needle just under the skin, and it's given every 6 months. And just like with Prolia, the reference drug, you need to ensure that you don't miss any doses, so you don't delay any doses, because you never want to delay those doses, because we know that there's an increased risk of having a spinal fracture or a vertebral fracture when you stop Prolia, if there isn't sort of a plan in place. So never stop your Prolia or your Jubbonti without first talking to your doctor, pharmacist, your healthcare team, because you can have that increased risk in vertebral fractures. Prolia will still be available on the Canadian market. It's still approved for use in Canada. And some patients will choose to continue on Prolia. It will mean, depending on your situation, it will mean either paying out of pocket for the Prolia, or some private companies may continue to pay for Prolia, but that's very dependent on the company, and I can't even begin to know which company will continue to cover it and which won't. But if you are covered under your provincial health, whatever that it looks like for you, there is likely a plan in place, or going to be a plan in place coming forward. There are some very rare circumstances where people may need to stay on the medication, the original medication, so the original reference drug. They could have some sort of immune reaction or other unmanageable side effects that they can't change to the new medication, but that's a one-on-one discussion with your prescriber to work through how that might work. Another question, excuse me, that we had submitted before today was the question of whether or not other osteoporosis drugs will move to biosimilars. So as I mentioned before, it doesn't apply to all medications. So bisphosphonates, they all have a generic drug now, and because those are regular chemical medications, it's a generic drug, so there's not a biosimilar, and those have all moved to generics. There is a biosimilar available for teriparatide, which is another drug we can use for osteoporosis. But again, the differences in coverage across Canada, it depends on your province. And then another drug called Denosumab, or Evenity is the brand name. It's still under patent, so there's not a biosimilar for that. A good clue about whether or not it'll be a biosimilar: drugs that end in MAB are usually biologic drugs. So anything that ends in MAB is usually a biologic. And because it's still under patent, there's no biosimilar available yet, but likely there will be once it is no longer under patent, so the company doesn't have that protection. What things do you need to think about while taking a biosimilar? Exactly like just taking your Denosumab, your original Denosumab, making sure you take it on time and that you're not missing that dose or delaying that dose every 6 months. Making sure you take your calcium and vitamin D as recommended by your prescriber or pharmacist to ensure you're not getting a low calcium level, because Denosumab can lower your calcium level, and that occurs with both the original drug and the biosimilar. Ensuring you continue to get your blood work done as recommended, along with your bone mineral density tests, whatever is recommended by your prescriber and what's allowed in your province. And then reporting any new or unusual side effects if you're noticing with the newer biosimilar that something seems different, and making sure you talk about that with your prescriber. So I'm going to pause there. I'm going to stop share and see what questions we have.
Teri, did you want me to read?
Sure, that would be great. Thank you.
Okay, the questions that we've received today, you have addressed, I think, most of them. So let's look at the ones that came in this week. One is, I had my first shot of Jubbonti last week after Prolia that I was taking for 8 years. Anything that I should be looking for?
Yeah, actually try not to look for anything other than if you feel different. So chances are if you had any side effects with Prolia or with Jubbonti, it's again usually within that first 24 to 48 hours after your injection. And if you're already a week or two out, you're probably good. And just like I said on that last slide, making sure you're getting your blood work done if your doctor's having you get your blood work done. And making sure that you are taking your calcium and vitamin D as recommended as well.
Okay. If I am on Prolia, when will I have to start taking Jubbonti?
It's going to depend on your province. So right now, I think 6 or 7 of the provinces have a program in place to change to Jubbonti. And some provinces don't. So I know Alberta doesn't have that in place yet. Saskatchewan, maybe PEI, but it will likely come. So it's something you need to talk about with your prescriber. And it's different by province.
Okay. And here's a good question. I know you addressed it, but it's worth repeating. How is Jubbonti administered? Is it different than the Prolia injection? Is it a pen or what, same, similar?
It's exactly the same. So it's in that, nice needle pen set you get, just like you would with Prolia, same sort of needle under the skin, same injection sites. It's exactly the same dose. Everything is the same. So it shouldn't look or feel any different.
Okay. What if I choose not to take Jubbonti? Is Prolia still going to be available to me, and will there be additional charges?
Yes, so Prolia will still be available. It's on the market in Canada and there's no end in sight to it being pulled from the market in Canada. Most companies continue to make it. There will be an additional charge depending on your coverage. If you have private coverage, it's something you could talk to your provider, like your insurance provider. If you have public coverage through your province, that becomes a bit more difficult. If you choose to stay on it, you will likely have to pay out of pocket. The price difference, and I do have it written down. Let me just grab my notes here. The price difference is relatively significant, but I just want to double check so I'm not giving any wrong information. So Jubbonti is about $190 a dose, and Prolia is about $440 a dose.
Okay. It's good information. Next question. How will the biosimilar affect bone quality compared to Denosumab?
So the effect on bone quality should be the same. Bone quality is really something that's very hard to study because it requires special techniques and imaging to actually get the quality of the bone. So it's not something that's routinely studied, but because we know it behaves similarly in the body, the expectation would be that it's the same, but it's not something that's routinely studied.
Okay. Okay, good. Does Jubbonti have any restrictions for long-term use? Are there any risks in taking the new biosimilar?
So not that we know of at this time. Ongoing monitoring by Health Canada will occur just like it does for Prolia as well. And as I mentioned, it's always, if you're on it, you need to make sure you continue taking it and not miss a dose because of that increased risk of fractures in your spine. Not stopping it without discussing it with your doctor and potentially having a plan in place to move to something else. So long-term use is exactly like Prolia.
Okay. There are a few questions in the chat that we haven't really covered. I don't know if can you see them as well as me, but
I think I can.
hey, just to see if
Oh,
you have
will
a-
other bands, yeah, so I have, will other brands be introduced as well? Uncertain, because there's one on the market now, like unless a company wants to fight for market share. So it's hard to say. I don't know enough about how drug companies work to know what their plan is, but unlikely.
Okay.
So, and then the next question, if so similar, why would someone switch or use the biologics? Well, from the government's perspective, it's less expensive. So that's why we would change for publicly funded medications, given, drug budgets are high. So that's really the main reason for the change.
Okay.
How safe is Prolia? So, relatively safe. The main side effects with Prolia and with Jubbonti, they were very, very similar in the studies or the trials. So that kind of flu-like feeling, generally feeling unwell, for that 24 to 48 hours after the injection, potentially a little bit of an increased risk of infections, although that's somewhat debatable. And then the big thing we worry about is on stopping, whether or not if you stop Prolia or Jubbonti, that you could have an increase in vertebral fractures.
Okay. This is a good question. I had some side effects when I originally started Prolia, but then they've disappeared. Is it possible that I'll have the same reaction with the original Jubbonti?
It's a great question.
Yeah.
Potentially, we actually don't know. Unlikely, because your body's already used to that medication. So often those side effects come because our body's not used to it. So it's our body's way of reacting to it. But because they're so similar, unlikely, but that doesn't mean you won't. Chances are, if you do have some small side effects after your first dose of Jubbonti, with your second dose, it should be better.
Okay. This question, can you expand on if one needs or wants to switch from a biologic? What are the choices? Yeah,
From a biologic to another drug, or from a biologic to a biosimilar?
I would think it's from a biologic to a biosimilar.
Yeah, so there's no there's nothing major to consider other than you know, making sure you're taking it at the same time in the same way. So there's nothing really unusual about the switch.
Okay.
It's just like if you were, it is honestly just like if you were switching from a brand name oral medication to a generic oral medication.
Okay. Can you confirm the injection sites for Jubbonti? It's the same.
Yeah, they're the same as for Prolia. So any sub-Q site, so you can do it under your skin on your arm or in your thigh or in your abdomen. So the same sites you would use for Prolia.
Okay. And someone is asking if you know where the drugs are manufactured.
You know what? I think that they're both manufactured in Canada down east. That's my understanding.
Okay. All right. Did you have anything else that you wanted to add, Teri?
I think these are all very common questions that we get from patients in our clinic. And I think, you know, it's understandable that there's some hesitation with people wanting or if they need to switch, if the government or their coverage requires them to switch. I will say that in other medical conditions where we've used biologics and biosimilars, the switch has gone fairly well for the majority of patients. So the majority of patients switch without a problem. There's very, very few problems with switching. So hopefully that, you know, puts your mind a little bit at ease, and it's just a matter of having that discussion with your prescriber and knowing what your province is going to be doing with coverage.
Okay. Well, thank you, Teri. That was wonderful. It was a great informative presentation. So if people want more information on osteoporosis, you can visit our website at osteoporosis.ca. And on our website, you'll find many tools, including our new nutrient calculator, podcasts, quizzes, a repository of past webinars, as well as listings like you can see here of future events for both yourself and your patients. And I just wanted to say thank you again to Teri, and thank you for joining us today, and wishing you a great day.
Thank you.
Bye,
Take care.
everyone.